One of the concepts we try to explain to patients, I'll ask them a question. I'll say, has anyone ever told you, or maybe you've heard this either yourself or someone else, yeah, you had a real bad sprained ankle, you would have been better off if you broke it. That's not uncommon to hear that. Orthopedic surgeons talk about that a lot. So you can have a bad sprain, you can have a break, sometimes you're better off with a break. A break oftentimes will heal in 6 or 8 weeks after you put a cast on it. Injure a joint, it can take a year, 18 months, up to 2 years for ligaments to grow back and muscles to grow back. So also explain to patients the ankle joint the ankle itself has a few joints in it. Spine is different in the fact that this is a plastic model, but there's over 300 joints in the spine. So it's more complex, there's more going on. We got the nervous system and the spinal cord running down the middle of it. That's the reason why spinal problems are oftentimes harder to detect, harder to treat, sometimes take a long time to get better. Because again, there's a lot more joints. A few joints versus 300 makes it a lot more complicated. So just a conceptual idea, help people understand the nervous system and the complexity of the spine. And it's important that it gets evaluated properly. That's how things get missed and how people end up with chronic problems. They don't ever seem to really go away. So just another concept we try to share. Stay tuned for more tips.